I'm Nedra Kinerk, and I want to welcome Hidalgo County Judge Richard Cortez to our Futuro RGV discussion on how COVID-19 is affecting our Hidalgo County communities and what to expect in the months ahead. And Futuro RGV moderator Davis Rankin will review with Judge Richard Cortez what we are learning and how we go forward in the midst of this COVID-19 pandemic. And first, I do want to thank our Futuro RGV sponsors who help us bring these discussions to you. And that's Rhodes Enterprises, Sam Garcia Architect, Frost Bank, IBC Bank, DHR Health, Clark Chevrolet, Rio Bank, DTM, Val Peason, Ernie Williams, Code RGV, Copy Zone, and Upper Valley Mail Service. Thank you all. And I do want to tell you these discussions and those of other Valley leaders will be on the Futuro RGV web Facebook page, YouTube, and social media for further viewing. And now, Davis, I will turn this over to you and Judge Richard Cortez to help us understand what we are learning to help us cope with the COVID-19 pandemic as we go into the months ahead. Davis?
Yeah, thank you very much, Nedra. I hate to call this a learning experience, but I guess if the people in authority are not learning something for the next pandemic, then that's not good. And Richard Cortez, the county judge, is in a good position to do that by virtue of his former CPA, forensic CPA, forensic accounting work. Also was a mayor of McAllen, city commissioner, and now the county judge. But I bet you did not anticipate. I have to think that the biggest thing you were looking at when you took over as county judge was the courthouse, which is an enormous undertaking. And then this got put in your lap. What do you think about all this?
Well, it's been very challenging. These are very challenging times and difficult times because it's created a lot of hardship for a lot of individuals and businesses. But you know what? We're going to get out of it. But we can't do it by wishing for it. We've got to do it by the actions that we take. I'd like to start off, if you allow me to, because there's a lot of misinformation out there, and everybody wants to second guess everybody's decisions. I'd like to start off with what's happening to the $151 million that the county received as a direct grant from the federal government. When this COVID-19 happened, of course, it was devastating to all the country, and the federal government wanted to very quickly put money into the hands of government so that we can fight this COVID-19. Well, in Texas, Texas received a tremendous amount of money, but the 4 largest cities and the 8 largest counties in Texas received a direct grant from the federal government. Hidalgo County happened to receive $151 million. Well, when we first received it, we had an idea of what we could spend it on, but we weren't sure. And we weren't sure whether this was all our money or money that we would have to share with somebody. We were led to believe that we were going to have to share some of this money with the cities, which is absolutely fine. Cities are within Hidalgo County, so whether we spend it or the city spend it, it's still spending Hidalgo County. So we received $151 million, of which after budgeting and determining and discerning what our needs were, we decided that we needed 37 million of that money to go for general benefits. As you know, the county is made up of 22 cities and the rural areas. When you put us all together, we have to provide services like a courthouse, a judicial system, a jail, a tax assessor collector, a county clerk, a district clerk, a health department, all of these things. So one of the things that we learned that when this pandemic happened is we had very little testing supplies. We're testing, in the teens, not in the hundreds, and we had to send it to a lab in Austin, send it to a lab somewhere else. So we wanted to make sure that we had a forensic center to invest in a future pandemic and a future thing. We wanted to be self-sufficient and wanted to have all of those facilities there. Then we also needed to retrofit our courthouse, retrofit all our offices. because we cannot be out of business. We have to provide services to people, and we wanted to provide it in a very safe thing. So that $37 million went to those things. When we were negotiating with the cities wanted all of the money, of course.
You've been mayor, you know.
Yeah, of course. You know, when you're an advocate for the city, that's what you're supposed to do. But, you know, having been around here and knowing that there's always unexpected things, I said, look, let's be prudent. Let's put 10% of the money for an unknown possible future need. And if by September the 1st, we don't have a need, and I was hoping we wouldn't have a need, then all of us can share in that $15 million in the proration based on population. So what it meant is that the cities got $70 million and the rural areas got $29 million, because in the rural areas we have about 1/3 of the people, believe it or not, live in the rural areas. We've been criticized that maybe we're not spending the money the way we should. Well, if we received $29 million for the rural areas, then you have to look at what do the rural areas need. Mm-hmm. So when you have all of your school superintendents telling us, hey, wait a minute, during this pandemic, when we stopped having face-to-face instruction, there was a lot of students out there that we couldn't reach. They couldn't have distant learning. So if there's any way that you can spend some money or help us connect these people, these students to distant learning, we'd like for you to do that. Also, I want everybody to know, as you know, I'm an accountant, 74% of the money that people earn that are living in the rural areas go to two places, go to two things. One is housing, the other one is transportation. Their jobs are far away from where they live. So having access to telemedicine is also very important going into the future, because a lot of those people, as we all know, are in poverty, and we all know they don't have insurance or whatever. So we wanted to make sure that this money that we receive for the benefit of those in the rural area will be spent. So we put aside $7.5 million to help them for making the payments for rent, making the payments for their house mortgage if they didn't have it. We put aside $4.2 million for businesses that suffered because of this pandemic. And it's going to cost us más o menos around $16 million to help add more infrastructure for the internet, or have access to that. I wanted to tell the people that, because I think it's important that when someone says you're going to skew the money one way or the other, there's more need here than the other, then there's different sources that are coming in from other places. So if you spread it out, you balance it, you blend it, I think you get more utilization for the use of the fund. So I wanted to tell the people, give them a little background about that. But now, Nedra asked, well, what's the future in this pandemic? Yeah. This fight for the pandemic. Well, you know, there's three areas that we have to look at. First, we have to identify that you have it. We have to isolate you so that you won't infect anybody else. Then we have to treat you. So identification has been a problem, because when we started, we had small numbers of people being tested positive. So it wasn't very difficult for us to go and trace. Where have you been? Well, you were in Las Vegas. Where did you do when you came back? Well, I went to work. Well, where do you work? Well, I worked at the doctor's office. Oh my God. Yeah. How many patients did you see, or how many people went into your stuff? So we were doing, contact tracing. But when you have 1,200, when you have that many people now that are testing positive throughout the whole state of Texas, throughout the whole United States, you can throw contact tracing out the window, because it's just too onerous. It's very difficult. So we're going to have to figure out how to test more people and how to give them the results of the test quicker. Here's where I've been asking the governor for help more than anything, because I think this is one of the problems, because not everybody gets to go to the hospital, thank God. No. Not everybody is that much sick. So when you're asymptomatic and you tested positive, you don't know that you are, You go back home, you go back to work or whatever, all of a sudden, now you've been in contact with thousands of people, and thousands of people now are in contact with other thousands of people.
You may have been unaffected. You didn't know you had it, but the people you give it to, it may kill them.
That's exactly right. Well, here's where I want to go next. As you well know, Hidalgo County, unfortunately, we have a very high level of people in poverty. So it's not unusual to go into a household that you find three generations. You have grandpa and grandma, you have mom and dad, and then you have the children. Children go out, they come back in. Mom and dad, grandparents are sheltered at home, say, but the kids are coming back in. And because of the close proximity of a small house, then they don't know how to manage. They don't know how to manage that disease in that environment. So that's one of the things that we're working on now. We have a task force made up of nurses, doctors, and other healthcare providers. I believe Austin has a very, very similar program where basically if once you test positive, then we want to isolate you in a place. We want to get you away from everyone where there's no possible way for you to infect anybody else. So we're working on that here in Hidalgo County.
Well, like, what would you do? Put them in a hunting camp on some large ranch where?
Well, yes. These were procedures and processes, strategies used by South Korea. In some places in China, they were very, very effective.
Really?
I mean, this virus is spread by contact.
Yeah.
People close to other people. So if we isolate you from people, then you're not gonna pass this. So the treatment part of it, when this thing first got started. When the governor took over, I mean, we had 3 people in ICU. We had, I think, 10 people in the hospital. We really had this under control. And during this time, I spent a lot of time with the hospitals. I wanted to make sure that we had the capacity. In case that we had a flare-up or whatever to treat them. So I was pretty confident that we did, because the hospitals themselves were planning for this. We were planning for this search. Well, all of a sudden, wow, when this thing really started escalating, the hospital, came to me, in panic. And I mean, it just really panicked. They said, hey, we're running out of capacity. We're running out of this. We're running out of that. We don't have enough staffing. We don't have enough personnel. So, I mean, what do I do? Well, I mean, I go to the governor. I go to the governor and ask for help, and thank God that he helped us with a lot of staffing to begin with. But then when we came back out for capacity, the state of Texas believed, and a lot of people believe, that the best place to have a patient is in a hospital, not in a tent, not in an alternative site, but in a hospital where they have everything else to give you the best treatment.
But the hospitals, they have finite capacity, do they not?
Well, they do, but you're still in the hospital. If we put you in the cafeteria, you're still inside the hospital. Okay. And that's basically what the state of Texas told us. So after a while, then the state of Texas, with the help of the governor, we were able to put two facilities. One, basically a hotel, where if you're already on your late stages of recovering from this COVID, that you're basically convalescing, then there's a hotel out there that we put you in that hotel until you're able to go home. And then, as you know, this week or this last week, the McAllen Convention Center was opened up with 48 hospital beds. Now, this hospital beds are not a full acute hospital. They're about kind of mid acuity in that, but it still helps the hospital make room and capacity for them. So that's kind of what we're doing for the treatment side of this battle that we have. The mitigation, as you know, Hidalgo County, I myself issued an order, stay at home an order. And of course, it's well known that the governor of Texas doesn't believe that any county judge or any local jurisdiction should have the authority to enforce that shelter-in-home order. I went ahead and did it because I said, you know, I won't have to appeal to the citizens, the residents of Hidalgo County to do the right thing.
This is like better to ask forgiveness than permission.
Well, we're trying to find solutions to the spreading of this thing. And I said, if 10% of the people abide by the order, I'm 10% better.
Yeah.
If 20%, 30% do it, then I'm really much better. But I think that people believe when the governor opened Texas back up that this disease was gone, and we know that it wasn't. So let's go into enforcement. You don't know how many text messages and emails and phone calls I get of people wanting for me to go to a flea market, wanting for me to go to a social place because there's gatherings of more than 10 people. Well, the truth of the matter is that we, the county, do not have any authority to go into a municipality and enforce our own rules.
Really?
And the rules. So we have to ask the local police department, the law enforcement people within the communities to enforce these rules, these regulations within the city. So if you have a flea market in Alamo, Texas, I can pick up the phone, and I have, and I can call the mayor, and I can ask, Mayor, it's been reported to me that you have thousands of cars out there and thousands of people lined up.
That's why it's such a great place, Richard.
You know, and that's all I can do. That's all I can do. So what I want everybody to know and understand is that this is a giant. This is a very difficult. How do you enforce? How do you control the free movement of 1 million people in Hidalgo County that we're all used to being free and being able to move anywhere we want to? So it's very difficult. So that's why, in order for us to solve this problem, government isn't going to solve it for it. We're going to solve it together. And the only way we're going to solve it together is to learn to coexist with this toxic virus. Businesses are going to have to learn how to operate safely, and people need to know that when you go out into the public, you need to do it safely. Well, how is that? Well, basically, it boils down to maybe 3 things. 1, we want you to have physical distance from a person. 2, we want you to cover your face. And 3, just use proper hygiene and sanitation. That would go a long way in putting an end to this nightmare that we have. I'm gonna give you time to ask me questions in a minute, but I have one more thing that I wanted to share with the people, and that is, you know, when we report, and every day we report except for Saturdays, and it's basically the same thing. And unfortunately, every time I report, I have to pay my condolences, to the many people that we're losing. But somewhere in there, we have undisclosed for a municipality. Well, this undisclosed for a municipality isn't meant to say that this people were illegal or we don't know who they were. It just basically means they live in a small area that if we say where it is, the neighbors may figure out who it is. And by law, we're not supposed to do that. So I wanted to explain.
This is the HIPAA regulations, which forbid particular information about a particular person, right? So if I go to the hospital, God forbid, somebody calls as Davis Rankin and they're can't tell you, because unless I waive those rights and they're not going to. That's too many people to do that.
That's correct. Well, I'll let you ask me some questions in case that I missed something, but I try to throw it out there as fast as I could for the things that I thought there was some misinformation.
Well, I figured of all the people we're going to be thinking about what happens next time, you would be the guy, and I assume all the elected and top appointed people are thinking about the same thing. What do we do next time? Because we're not through this. According to Dr. Ivan Melendez, who is the county's the county's doctor. He says we're not going to be through with the hand washing and all that kind of stuff until we have a vaccine or we have herd immunity, which is a variable figure I've heard, but we're not anywhere close to those yet. So we're hand washing, face mask wearing, that kind of thing for the duration. I told you at the beginning I wanted to ask about blood tests because I have not. My wife went to the doctor because she thought she'd been exposed to somebody. She had the PCR, the swab in the back of the throat, which is the only one, according to a doctor, that will tell you if you have it now. The rest will tell you if you have had it. But this being a free market system, there are lots of tests available. What's it going to cost or take for the county to have a laboratory where they could send the stuff in and get pretty quick? Apparently it's not that it's not that hard to get a PCR test read real quick, but if it takes days or weeks, it's
okay. Remember where I started, the use of the funds. That is exactly part of where the $37 million is going to. We want our own forensic lab. We want to have our own tools of the trade, if you will, where we don't have to go somewhere else to get it. That we have total control. And the morgue, as you can tell, I mean, we have a small morgue, and then we needed to get all these refrigerated trucks to do that. So we want to be prepared, and that's where this $37 million is going to, for testing and supplies, to make sure that we are self-sufficient in the event that something like this happens again.
What about putting the lab at the University of Texas Medical School in the medical school at UTRGV?
Well, you know, that was a recommendation and a suggestion. I've always been one that wants to eliminate redundancy.
Yeah.
And if they have it and we had it, then by definition that would be redundant. The only thing is that we don't control the medical school at the university, so they get to decide what their priorities are. So for us, we felt that that's not what the people of Hidalgo County needed. We needed to be self-sufficient ourselves, and that's what we decided. However, we did allocate $5 million of that $37 million back to the medical school, because with them, I'm going to tell you, we would have been in big trouble without the medical school, because they helped us so much with testing. I tell you, I couldn't be prouder of that institution. We're just really lucky to have it.
Do you know, there was a report a couple of weeks ago that some of the materials that you need to read it, to do the test, were not available, that they'd been bought up off the market or something like that. Are you aware of any of this?
Well, yes. I mean, no, everybody was used to normal capacity. So production for those supplies were based on supply and demand at that time. So when the demand exceeded supply, then everybody was fighting for whatever was available.
The other thing, if you live in a city, if you drive outside the city, western Hidalgo County or north of the expressway, pretty soon you get into very rural areas, and I doubt they have good Wi-Fi in those areas, but a lot of people live there. How in the world do you extend modern technology, but if you want to put it that way, to that area, to those areas?
Well, through partnerships, through partnerships with the schools, the state, the county. You know, county. We have buildings on the rural areas. Schools have buildings on the rural areas. Schools are different. Their jurisdictions are different than municipalities. So it takes a partnership. The good news is that I believe that the state of Texas already, and the federal government already is appropriating millions of dollars to help all of America, you know, bridge this digital divide. So to us, it's very important. When you have that many people as we have in poverty, we all know that education is a good way to get you out of poverty.
Yeah.
So if we're not educating our kids and we're not giving them an opportunity to distance learning, then we're in deeper trouble than we are by not investing in those things. That's why I felt very comfortable, and I don't care who criticizes me for the way that we've allocated it, because I believe that we allocated the funds in a very balanced way.
I guess we'll probably have time for one more topic, and that would be, do you happen to know what percentage of all the people who get sick with COVID have health insurance of any sort? Medicare, Medicaid, private insurance? I'm assuming that the vast majority of the reported cases, the cases reported by you, and in Cameron County too, every day, are uninsured.
Yes. Well, the answer to your first question, I don't know what percentage have insurance, but I tell you that speaking to the nurses and people in the hospitals, some of our people are waiting too long to go seek healthcare services. By the time they get to the hospital, they're very sick. So unfortunately, one of the reasons that they don't go there is because either they're illegal, they're afraid to be caught. Number one, they don't have any money to pay for the services. So these is not the only reason, but one of the reasons that we're having a high mortality rate, because some people are waiting too long, and we're going to have to figure this out. We're going to have to figure this out, because we can't let them die. We have to treat them as soon as we can.
I think this is a good place to stop. There's been a torrent of information, and for good or for ill, we can do this next week, and there'll be another torrent of information, because that's just the way it's going to be down here in the Rio Grande Valley, Hidalgo County, as we wrestle with COVID-19 and all the other issues which bubble up to the top as we deal with this. Thank you very much, Hidalgo County Judge Richard Cortez.
Always my pleasure.
And you're listening to Futuro RGV. I'm Davis Rankin. Thank you for joining us.